God bless you. I'm Bishop Jerry Maynard, pastor of the Cathedral of Praise right here in Nashville, Tennessee. And I'm very happy to be with you tonight to discuss some matters of concern for not only the members of this church, but for members of churches everywhere. And the reason for that is that we are getting ready to open our church, not only Cathedral of Praise, but churches here, there, and everywhere. Joining me today is Dr. Shindana Feagins, and Dr. Shindana Feagins is a medical doctor in the city. She's also a member of the board of directors of a general hospital, as well as on boards of other entities within the city. And I'm glad to have her with me to discuss the particulars of concern that you may have and I may have as it relates to what are we doing with reopening our churches, and how do we merge medicine, how do we merge chemistry, et cetera, with faith. And so, Dr. Fagan, we're so glad to have you with us today. And why don't you introduce yourself and then move from there in points of discussion.
Thank you, Bishop, for having me today. I'm Dr. Shindana Feagins, and I'm an internist practicing in Madison, Tennessee. We're located on Due West at 607 West Due West Avenue in Madison, right across from the old Memorial Hospital. I've been practicing medicine since 2001. I'm a graduate of Meharry Medical College. And in my practice, I basically see adults 18 years of age and older. And I treat acute and chronic illnesses such as hypertension, diabetes, and acute infections. So I'm very glad to be here today. One of the things, we're in this pandemic, the coronavirus pandemic. And so I'm here to talk to you today about coronavirus and answer a few questions that some of the most common questions or frequently asked questions that have come up since this pandemic started. But let's start with what is coronavirus. The coronavirus is also known as SARS-CoV-2, and SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. And it's a virus that basically is spread through respiratory droplets from person to person, and it causes severe respiratory distress in some people. Some of the symptoms, the main symptoms, are cough, fever, and shortness of breath. But there are other symptoms that are less common, such as headache, fatigue, GI symptoms such as abdominal pain and diarrhea. And some of the most recently symptoms that are starting to occur in children is a rash, and they have fever, and in some cases they end up having acute coronary issues such as cardiac failure. And it was previously thought that the virus did not really affect children, but we're seeing more and more children coming up with this virus, and so that's become a concern. The main thing in terms of preventing the virus is that you want to practice physical distancing. As humans, we want to be social with one another. So I don't call it social distancing, because you can be social with someone through the internet, FaceTime, social outlets such as that, Zoom, but physical distancing. So you want to remain at least 2 arm lengths away from another person, which is considered 6 feet distance. You also want to make sure that when you go out in public, you wear a mask like what I have on, or a cloth mask, or whatever you have, whether that be a bandana. The purpose of the mask is to prevent you from spreading the virus to someone else. It doesn't necessarily protect you from getting the virus, but it protects you from giving it to someone else. So that's very important, because you have to kind of look at it like this is just not about us. We're in this together, so we have to take the precautions to try to protect one another. The other precautions that you need to take is hand washing. It's very important that you wash your hands. When you touch something, or you go shopping, or you go out in public, when you get home, it's important to wash your hands. You wash them for 20 seconds. That's like singing the happy birthday song 2 times. And if you don't have access to soap and water at the time, you can use a hand sanitizer and make sure that it has at least 60% alcohol in the hand sanitizer. Also, if you cough or sneeze, you want to cover your mouth. You know, the best thing is to cough or sneeze in your elbow. It keeps you from getting the respiratory droplets on your hands if you were to use your hands to cover your cough or sneeze. And so those are the main things. Wash your hands, use hand sanitizer, physical distancing, you know, and if you cough or sneeze, cover your mouth. The last thing is if you come up with symptoms that I described earlier, and you think that you may have been exposed to the virus, you want to self-quarantine. Stay at home. Don't go to work. Contact your doctor's office and let them know what your symptoms are, and they can direct you on what you need to do next. So that's basically it. We did have some questions that were sent. Let me look at those real quick and I can address those. One question was, every time you get a virus or illness, do you always build immunity to that illness? So let's first talk about the antibody test. They have antibody tests that they're trying to develop. Some have not been FDA approved. So there's the question is whether or not if you get a false negative or a false positive on these antibody tests, are they actually accurate? So what the antibody test does is when you come in contact with a pathogen, a virus in this case, and your body, you become infected with that virus, your body sets off an immune response to try to fight off the virus or the pathogen. And in doing so, you develop antibodies. And so that's what the test is looking for. It's looking to see if there are antibodies in your blood when you were exposed to this virus. Now, the question was, do you build up immunity once you are exposed to a virus? Based off of history, when you are exposed to a virus, generally, you build up immunity to that virus. This virus is a novel virus. It's new to us, and it's a part of a family called coronaviruses. And generally, with the coronaviruses, you do build up immunity. It is too early to say how long that immunity will last. Researchers have to look at patients and people who have been exposed to the virus, who have recovered from the virus, and then follow them over a period of time to see how that immunity works. You really can't say that, okay, if you get the virus, I won't get it again. It's just too early to say, but we do anticipate that if you, based off of history, if you were to get the virus, you would build up immunity to it. If you got it now, and then in February, March of next year, you know, just like flu season, you have a coronavirus season, you may be protected from that virus. But again, the research is still out there on that. So the second question asked, and it's kind of similar, does immunity last forever? I would say at this time it's too early to tell if immunity lasts forever. And the third question said, before COVID-19, a person sitting behind me coughed. The next day I became ill. It appears we need to protect our heads as well as our eyes, nose, and mouth. Your thoughts? So if someone coughs or sneezes on your hair, basically, those respiratory droplets, the way that the air flows, you know, when you're moving, you're pushing air out of the way. So you're pushing those viruses out of the way too. Those respiratory droplets, they don't stay in the air for a long period of time. But if someone is in close contact with you and they cough or sneeze and it lands on your hair, but it's going to land everywhere else, that viral load is probably not, in order for you to, it's a low likelihood that you would get sick from that. For one, you have to think about everything that would have to occur for you to get sick. You'd have to touch the area in your hair exactly where they coughed or sneezed, where those viral loads are. then you would have to touch your eyes, nose, or mouth in order for that to be transferred. So if somebody's behind you, it's just a very low likelihood that that would cause you to get ill. Like I said, it's a direct person-to-person contact where the respiratory droplets, if somebody's in front of you and they cough or sneeze in your face and they're infected with the virus, those viral particles can get in your mouth. If you're talking, they can get in your nose, in your eyes. So the probability of just somebody coughing or sneezing and gets in your hair is low. It's not necessary when you go out for you to come in and take a shower every time you walk in the house, because the risk of you getting the virus just from going to the grocery store, minimal contact with people, and then coming home and spreading that virus is very low. So you don't have to, in my opinion, my professional opinion, I don't do it. I don't, every time I go shopping or go out, I don't come home and undress and take off my clothes and, take a shower. That's overkill. Of course, if you go to the grocery store, you want to wipe down, your products and things like that, because the virus can live on cardboard for 24 hours. It can live on hard surfaces like plastic and steel for up to 3 days. And so things like that. But, if you disinfect your counters, when you spray the disinfectant or wipe it, let it stay wet for a while before you dry it off. That kills the virus, gives it time to work. As far as masks, when you come in the house, you take your mask off. Of course, you want to wash your hands first, remove the mask, and hang it up. And try to avoid touching your hands, your face and your eyes and your mouth. Put your groceries up and then, wash your hands again. Just take the precautions. The main thing is wash. I can't say it enough. Wash your hands. So, Bishop, I'll put it over to you.
Well, thank you, Dr. Fagan. You've been very much informative, and I'm sure those of you out there have heard and understand. And the trying to determine what we should do as it relates to faith, and then what should we do as it relates to what we call stupidity. Faith is not stupid, and but it does require for us to use some sense of intelligence. There were some questions asked of me, and I want to involve myself in those, and then I'm going to come back to Dr. Fagan, and then we're going to close out. The first question that was asked of me is, how will the congregation be seated so that we're not sitting closely to one another? That's talking about when we reopen our church. We will practice distancing. As Dr. Fagan says, I don't call it social. We're not having a social activity here. But we are going to be spaced in the church in such a way that people will be able to come in and enjoy themselves without fear of having a problem. Another question that was asked was, how will offerings be collected? That we're not touching other individuals' envelopes. Of course, the point is this, that maybe the virus is on one of the envelopes or something. Well, we have Givelify, we have Cash App, we have the church app that you can give to, online giving. We have an icon that one can just touch and it will show you how to give. We can do that. In addition to that, you don't have to wait until you come to church on that Sunday. You can mail your contribution in, or you can drop your contribution off at the church. So there are 5 different ways that you can give here at the church, and we thank you because that's what we have been doing, and it's been outstanding, and so we can continue with that practice. The third question was, experts have said that they expect the coronavirus to be around for 2 more years. So will the mitigation efforts to keep people safe at church be temporary, or will it be until the virus is gone? Well, let's say like this. We here at the church started before it became a problem nationwide here at this church. First of all, we keep a very clean church here. Number two, we have been sanitizing our facility, all the pews, the carpet, the door handles, knobs, in the bathrooms, sanitizing the bathrooms, all over our building, microphones, everything. And we have been doing it, but we have intensified it to the extent that we want people to feel safe when they come in. And the fact is that we, at the beginning, when people come to our church, we have the gun. And that we can utilize to take the temperature of people as they come through. There's a question that asks about that. We take the temperature. It's important that we take the temperature not only as it relates to coronavirus, but I believe that people need to know whether or not they have a high temperature or it's very low. So we do that. In addition to that, there are stations for sanitation as people come in with regard to your hands, etc. And the other thing that we have, and I'll show you, we have a mask that we will be willing to give to people when they come in, that you can wear that mask, put it on. If you want to, you can sit through church services with the mask on, or you don't have to have the mask on. That's going to be up to you. Now, the question is, if this lasts for 2 years, there are certain things that we believe, and at this church. In September, we started reading the 91st Psalm, and we have read that 91st Psalm for each of our services since then up to now, and we'll continue to do that. And you say if it lasts 2 years, we'll continue to read it for 2 years, because we're going to merge our faith with medicine and with the understanding of science, etc., because we do understand that the two don't have to be so opposite of each other, but they can have a marriage. And in this particular case, we need to know what to do, how to do, when to do, why to do, and then exercise the faith that we have in our belief in God. I have said often to this congregation, the mask within itself is not going to save you from any harm, but the mask wearing will protect others. But at the same time, God is greater in you than what the mask is on you, but having both of them working together is good for all of us. So the question is, again, and I just answered that, will people be required to wear a face mask during church services? If so, for how long? That's going to be up to the people. I have a mask on right now. It's around my neck. I may look off with this here, but the reason I have it on, because I wanted to show Dr. Fagan has her mask on. I have mine with me, but I did not put it on. And I feel comfortable speaking to her without having it on, but at the same time, I could easily have it on, and I'm not going to, haven't been doing any coughing. I don't think I'm going to do it. The fifth question, the coronavirus has already impacted churches around the United States, where many church members have tested positive for coronavirus and have died from the virus. So how do we use faith versus stupidity in attending church services to ensure that we do not fall victim to the coronavirus as other churches have done? Well, what I said again is what we have done. This church building is completely sanitized. When people come into an office, if they have to meet me in the office, our environmental service crew will come behind them and sanitize where we have been meeting. We will go to different places of the church if somebody has been there, and we will sanitize it. We have been doing that. Some churches don't sanitize. Some churches, and I hate to say it, but some churches before coronavirus were not clean, and since coronavirus they're not clean, and after coronavirus they're not going to be clean. And you have to be careful where you go. But if we are God's people, then my grandfather used to say, cleanliness is next to godliness. So we have to be clean, we have to sanitize, we have to make sure. anybody who is fearful of coming to church for the next 2 years, I would say to them this: you have every right to make a choice as to whether or not you come to the physical property of the ministry that where you're involved in church building that you attend. You have every reason that you desire to have to stay home. And as a pastor of Cathedral of Praise, I am not going to criticize you and make you feel like you don't have faith because you don't come. One of the things I am going to say, however, is that we have been under the protection of Almighty God. We have complied with what has been asked of us with regard to not having a church full of people and with having people sitting in different places. We have done that and will continue to do it. But thanks be to God, not to us, but thanks be to God, I have not received one statement from anyone where any member of this church has contracted coronavirus, not one. And that's a blessing from the Lord, and I give God praise and honor for that. I am a shepherd who is interested in the body of Christ. I think of you as I do myself and my own family. It is not my desire to see any of you in a situation where we were negligent in our responsibilities and duties to cause you to be inflicted and have this virus. So we are very much on it as it relates to that. There are a couple other questions. I'm going to get to those right now. It asked the question, how will the church maintain social distancing by having a combined service for the 8 a.m. and the 10 a.m.? In other words, if you, Bishop, if you have more people coming on that day, how are you going to do that? That is a great question to be asked, and I'm looking at where we are and what we're doing. If everybody comes out that day, we can do physical distancing. It would not be as acute in so doing as if we just have the two services. But I tell you one thing is for certain. I have until the first Sunday in June to give a lot of thought to whether or not we combine the service for that day or we have both services, 8 o'clock and 10, and I have not ruled out that possibility. And I do know the second Sunday we will have the 8 o'clock and the 10:45. And so we might just do that on the first Sunday. But that question will be answered in the immediate future. Question, will you obtain the temperature of all attendees? And I think I indicated that we will use the gun, and we will, when you come in, we're going to ask you to do it. Sixth question, which is an interesting question, which is a follow-up to that question. If an attendee refuses to have their temperature taken, what is the consequence? Well, let me just tell everybody that I have mine taken. I have it taken every day. And I think that if we love God and we love each other, that we will have our temperatures taken, because we're not trying to abuse anybody, infringe upon anybody's freedom, but we are saying that we're concerned about each other. By this shall men know that you love one another, that you're willing to extend yourself because you love one another, and that you have love one to another. You can't love me if you're not willing to protect me. And so Amen. That's how I feel about that. We have to protect each other. I hope that I answered those questions that you asked of me. And let's go back to you, Dr. Fagan. We have a few minutes left. Let's go back to you. We're going to reopen. And you heard the questions and you heard my answers. As a medical professional and a member of this church, a lover of God and God's people, do you think we're handling it all right, or are there other things that we should do, or just give me some advice?
I think it's going to take the effort of everybody. I think that you are going in the right direction. In terms of, like I said before, in terms of the parishioners, it's not just about me as an individual, but we're in this together. So it's very important, in my professional opinion, that you do wear a mask, although it's not required, because you're not just protecting yourself, you're protecting basically, the person who's sitting beside you or in front of you, or, from getting the virus. Because a lot of people are out here, they're asymptomatic and they don't even know, they don't have any symptoms at all, that may have the virus, and they could pass it on to somebody else. So it's very important when you're out in public, wear your mask.
Okay, you heard that she's saying that although we may be physically distant from each other, but in the congregation, wear your mask. And so it's going to be interesting with not just with the parishioners and people in the congregation wearing their mask, but if the choir or the praise team singing and they have their mask on, and the sound that comes from them when their mask. And here again, as cumbersome as that may appear, the question is, what might be the alternative if they don't wear the mask? That we don't want them either to become ill. And I'm sure that's what you're saying.
Yes, because even when you talk to someone, you are expelling respiratory droplets. It doesn't have to come from coughing and sneezing. When you talk, you expel respiratory droplets. And when you sing, you're singing with a lot more force than when you're talking. So,
Doctor, are you trying to tell me I should be looking this way instead of over here?
I have my mask on, so I feel just fine.
I have my mask. I didn't put it on. I'm looking at Doc. Doc looking at me like, you ought to have that mask on, Pastor. Well, anyway, she's concerned about people. Obviously, mine is for people in their physicality as well as their spirituality, mostly spirituality because I've been called to that. Now, there are some things that people need to know, that you are a person who, one, believes in God, you have faith, both you and your husband. He's one of the deacons of the church, and you're really concerned about people in the community. And once again, would you tell the people where you are located and tell them some of the areas of medicine of which you are? And I believe this, that we have people from this church who, and you're their doctor, and I believe that you can be a great help to people throughout this area.
Yeah, so one of the things that we've done, I shut my office down 7 weeks ago. And since I shut it down, actually, I've had 7 patients come back with the coronavirus that were positive. 2, I suspect. But what we've been doing is using telemedicine. And what telemedicine is basically like a FaceTime. We keep our physical distance. I address your medical issues by phone or through social media, but it's through FaceTime. And so if you need an appointment, if you can't get into your doctor, you can contact us and make an appointment at area code 615-860-8182, and I'll repeat that, 615-860-8182. And again, I am an internist by training, which is a primary care physician, and I treat adults 18 and over. I think my oldest patient was that I've ever had was 106. So, and I treat hypertension, diabetes, chronic medical issues, as well as acute issues, such as your common cold or bronchitis or things like that.
And so you're well prepared. You've gone to school, and you've passed the boards and all these things. And so people can come to you and be assured that you know what you're doing.
Yes.
And what you cannot handle through the methods by which you have been trained, learned, God is there equally as well to support you. And so we are going to be on each Friday at 6 o'clock, and we're expecting God to be with us and these questions that you have to ask of us, because we're not going to only talk about the coronavirus, but we're going to talk about other things that people may have. and how that we can merge once again faith and medicine. I don't believe that God wants physicians to feel that they have not been called, because they have. And then he does not want physicians to feel that we who are in faith ministry have not been called, but we merge and we come together, and through the efforts that we have, we're able to bless mankind. So we're asking you, don't forget, every Friday at 6, we will be on air. Again, Dr. Fagan, I appreciate you being with me on tonight. And to those of you who are looking forward to come to church, perfect love cast out fear. Come prepared. God is with us. And if you don't come, there is something I want you to know. We are where you are.